All right, hey guys, day number, what are we at, 6? I think we're at 6. Kind of a setback a little bit. My two kids woke up coughing pretty good. It's usually in the morning, that it's the worst, and that's all that stuff kind of sits down in the chest, and then it's blah, 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 hacking all that junk up. During the day, they've been a little bit better, getting more of that mucus out, and I still think that we're kind of nearing the end there. For me, I'm still a little plugged up in my nose. I feel pretty good. Like I'm not exhausted. I don't have headaches or anything like that anymore. So I think I'm kind of nearing the tail end of this thing as well. Anyway, these things are just annoying, aren't they? You just don't want to be sick. But Afrin or oxymetazoline has been working great for me, and usually it works well over the 12-hour mark. So I think mine just wore off from spraying it last night around 9 p.m. So that's why I'm a little bit plugged up right now. Anyway, I wanted to hopefully I can briefly go through over-the-counter medicines with you guys. This is so important. You go to the grocery store or to the pharmacy and you look at those shelves and you go, okay, there's so many options. What's going on here? And really the key to it is just knowing the generic names. Okay, so I'm going to try my best to do a very brief kind of pharmacology lesson with you guys. Okay, so what do we start with? How about fever and pain relievers? Those are going to be your things like Advil, Motrin, Tylenol. Those are all brand names. But so fever, pain, so headache and all that. Hopefully you can read that. Acetaminophen. That's the active ingredient in Tylenol. And then ibuprofen. That's the active ingredient in your Motrin and Advil. Oh, and Aleve would be naproxen. So as you look at the small print underneath these brand names, just figure out what they've got. What is this thing? And then you can compare apples to apples instead of like, well, Advil cold and sinus versus Tylenol cold and sinus. Well, the thing about acetaminophen or Tylenol, that one gets processed through the liver, so you want to be careful if you've got any liver issues. And don't drink alcohol with that, okay? Well, probably with most cold things, you don't want to be drinking alcohol. Naproxen and ibuprofen have more of a risk of upset stomach, gastritis, inflammation in the stomach, maybe some kidney issues. Stay well within the recommended dosages, and if you're a healthy person, maybe I should qualify this and say these things are for otherwise healthy people. If you've got diabetes or congestive heart failure or neuropathy or whatever is going on, you might need to talk to your doctor even before getting into some of these over-the-counter medicines. Okay, so a little disclaimer there. So fever and pain, that's going to be your Tylenol, acetaminophen, ibuprofen, Advil, Motrin, and naproxen or Aleve. How about decongestants? These I kind of mentioned before too. Maybe I should use different colors. Decongestants are going to be things that really try to dry you up. They cause vasoconstriction. They shrink the blood vessels in your congested areas. So these are going to be things like the phenylephrine, and pseudoephedrine. So pseudoephedrine is the active ingredient in Sudafed, which is available now behind the counter. You can't really get it on the shelf anymore. You have to go and sign for it behind the counter. Phenylephrine is still in a lot of different medicines. Your Dayquils and whatever, even NyQuils. So those are going to be the dry you up sorts of things. You don't want to take those if you've got elevated blood pressure or anxiety can be another one of those things. It just kind of raises up the angst level a little bit. Now another one is the one that I've been mentioning a few times. That's the oxymetazoline. Oxymetazoline. This one is primarily a nasal spray. So I'm using a nasal decongestant to try to open up my sinuses, but there is a risk of rebound, swelling. If you use it too much too consistently, then once it wears off, it's like fills right back up again. So that's why you want to use something like an oxymetazoline nasal spray a little sparingly. How about antihistamines? Antihistamine. There's a whole bunch of different antihistamines that are prescription and non-prescription. The ones that we're mostly familiar with are diphenhydramine. That's your active ingredient in Benadryl. So again, there's brand names like Benadryl, or there are generics like Waldryl, which is diphenhydramine. Same 25 milligrams or 50 milligrams, depending on the strength. Diphenhydramine, doxylamine. These are the two that tend to be more sedating. So they're going to be in the nighttime versions of things. So your Advil PM type thing is usually going to be ibuprofen combined with doxylamine or Benadryl. They just market it differently. So again, knowing the small print active ingredients is the key to decoding all 1,000 products, because they're all the same, just rearranged differently. Okay, doxylamine, that'll be in your NyQuil type thing too. So those are some of the I think those are considered first generation antihistamines. And again, there's a whole bunch of other ones. Other ones that you're going to see perhaps that you can get over the counter are going to be loratadine, cetirizine, and fexofenadine. Okay, loratadine is your Claritin, cetirizine is your Zyrtec, and fexofenadine is your Allegra. These are second generation, I believe, antihistamines. They are supposed to be a little bit less sedating. So these typically get used more in cases of, environmental allergies, hay fever, stuffy, itchy, watery eyes kind of a thing. Diphenhydramine is one of the go-tos for allergic reactions, poison ivy, bee sting, that kind of a thing. These ones can be used that way as well, and they're a little bit less sedating. So a lot of times I'll tell folks, if they're dealing with an allergic response to something, hey, take your Claritin or loratadine in the morning and take your Benadryl or your doxylamine before bed. That seems to work out pretty well. What else? Expectorants. Essentially what's going to thin out mucus. And really, there's probably more, but I only can really think of guaifenesin. Guaifenesin? Guaifenesin. That's the active ingredient in your Robitussin and Mucinex. Okay, these are pretty safe for most people, and it's first line treatment for bronchitis. You get that mucousy cough. This is going to help thin out your mucus a little bit. I mentioned in a previous video, though, that water is even better. So if you can drink a lot of water, that's going to work great. Combine it with some Mucinex, Robitussin, guaifenesin, X generic brand, whatever it is, that might help you out too. What am I missing? Antihistamines, expectorants, decongestants, fever, pain. Is that it? There's probably something else, isn't there? But what is it? I guess I didn't prepare for this very well. I kind of intend to maybe put this into a cheat sheet of sorts. Let me know if you think that's a good idea. But again, just because people don't know these things, and I feel like the pharmaceutical industry just takes advantage of our ignorance, and they just repackage things and they combine, now new with, whatever it is, and it's just the same medicines over and over again, repackaged with a different flavor, So if you know these things, and you can start to kind of look at the boxes and say, oh wait, these this has 25 milligrams of Benadryl in it, or diphenhydramine, and this one's got 50 milligrams, but this one's cheaper, so I can actually get better bang for my buck this way. You know, so learn how to decode this stuff, and that should help you save money and also help prevent you from doubling up on things. Like you got to look at those ingredients and make sure that you're not getting a super high dose of acetaminophen because of these combination things that you're taking. Okay. Oh, here's another one. Cough suppressant. Suppressant. I'm spelling. Whatever. You know what I'm trying to say here. That's going to be your dextromethorphan. Yeah, dextromethorphan. So that's another ingredient that you'll see in a variety of these products. All right, we're already nearing 11 minutes here, so I got to wrap this up. The last thing I think I said that I wanted to mention. Oh, you guys can't even see that down there. Dextromethorphan right down there. So when do you throw in the towel and say, hey, you know what, I do have a sinus infection? Truthfully, doctors are always guessing. We don't know unless we go in there and take a sample and culture it out. We don't know if it's bacterial. You know, a lot of times it's not. But there are certain things indicators that we use to try to determine whether it might be bacterial or not. The first one is duration. How long have you had symptoms? Have they been steadily worsening for at least 10 days? You know, 14 would be better. You know, we feel more comfortable saying, okay, if it's been 2 weeks and you're still fighting this thing, maybe it's worth trying an antibiotic. The other one is how severe is the pain and the pressure. You know, again, if there's pus in the cheeks, or it's going to give you real bad tenderness, like I'm plugged up right now, but that doesn't hurt at all. So if I've got real severe pain in my maxillary sinuses, you know, back there or in my frontal, maybe that indicates that there's bacteria growing there. Also, dental pain. If you have pain in your top teeth, because that's where the maxillary sinus is kind of touching those the nerve roots from the teeth there. So that's the other thing. The third criteria would be, hey, I thought I was getting better. Everything was going the right way, and then boom, all of a sudden I got so much worse. That might be a third indicator that maybe this is a bacterial infection and we should treat it with antibiotics. Now, arguably, even antibiotics are not miracles. I mean, they can be. I guess if you're dying from a pneumonia or from some abscess or bad internal infection, we're thankful for antibiotics. But a lot of these non-life-threatening things, you wonder if it's really going to help that much. A lot of I just had a conversation with an ear, nose, and throat specialist recently who was like, you know, a little bit of Flonase, maybe some prednisone, whatever you can do to reduce the inflammation in the mucous membranes allows the mucus to pass out and then flushes out and you're good. So that's why I really emphasize, you know, the sinus, the nasal saline, the sinus rinse. You could use the colloidal silver, doing various things to open up and treat the mucous membranes in the sinuses. So that was a lot. Hopefully it was helpful. Again, please leave me comments and feedback. I'm kind of curious about how these things have been going. In my online practice, I mean, every day I've got 10 people who are dealing with sinus issues, and so it's kind of been nice to have some sort of a thing to point people to. So anyway, maybe we'll do a condensed version of all this stuff, and I don't know, I've got all these ideas in my head, but I want some feedback from you guys. All right, 14 minutes, way too long. All right, hope you guys are doing well, enjoying the warm weather. We're like back in 80 degrees up here in Michigan, so hey, cool. All right, take care. Bye-bye.